Okay, so we're gonna do our hand washings check off here. So first I would remove any jewelry, rings, bracelets that I would have on and roll up my sleeves. And then I would assess for any cuts, tears in the skin, signs of dirty spots, anything like that. All right, and then we'll turn the water on warm. What are forearms here and hands. So I'm going to talk about some precautions here. First you have contact precautions, and in this kind of precaution would be diseases such as C. diff, MRSA, and then the PPE that will be used will be gloves or a gown. And our second type of precautions are droplet precautions. And diseases in this category would be like influenza or bacterial meningitis. And the PPE that you would use for droplet precautions would be gown and gloves as well, but also you would have a surgical mask on. And if there was any risk for getting any contact with bodily fluids, a high risk, you would wear goggles as well. So in our last precautions is airborne precautions. And with airborne precautions such as diseases like tuberculosis or measles, you would need to use a N95 respirator mask to filter out any airborne particles in the air. And these patients would typically be or have to be on isolation precautions because they would need to be in a negative pressure room to avoid infectious risk with other patients. Now, patients that can be in the same room can be patients with the same disease, or if they have a non-infectious condition like a bone fracture or just a cut or something like that. Patients, another big thing, patients that could be immunocompromised, like patients with AIDS or neutropenia, they would also need to be isolated away from any other patients because they would have a higher risk of developing infections.